All right. Well, welcome everyone to the Healthspan podcast. I am your host, Dr. Robert Todd Hurst, and I am joined today, as always, by our head health coach, Rylan Hoffman. Welcome, Rylan.
Hi, everyone. Excited to be here. Dr. Hurst.
Yeah, oh, me too, because today we're talking about a really important topic and one that I talk with patients about a lot, and I think at first people may be a little bit confused. Like, why is a cardiologist talking about cancer prevention? But as you know, Rylan, here at Healthspan, we are looking at the science of the evidence-based approach to helping people live a long and vital life. We know heart disease is the leading cause of death. That's not anything that we should be proud of in the cardiology community. But cancer is the second leading cause of death. And as we're going to talk about today, how to prevent heart disease, very, very similar to how you can prevent cancer. And so this was eye-opening information to me when I talk a lot about how during my cardiology training, I was planning to be an interventional cardiologist. I say, like all good cardiologists, I was going to put stents in people because it was exciting. It was fun. We could fix people, quote unquote, fix people. I learned later that it maybe isn't as straightforward as just fixing arteries. But when I learned that 80% of heart disease, and really the more recent research suggests 90+% of heart disease, the leading cause of death, the leading cause of disability in the world, is preventable. Well, I changed my focus. I got passionate about what I could do to keep people out of cath labs and from being having stents done, more so than what went on in the cath lab. But even more so when I learned that the same things that I was learning about how the importance of that in preventing heart disease were also exactly what the people that were expert at cancer were recommending for people to avoid cancer. Well, I just realized this is something that's even bigger than what I originally thought it was. And so that's why our company, our practice is not called, preventing heart disease of some sort. It's Healthspan, because these factors we're talking about have a lot more benefits than just preventing heart disease. So, Rylan, you and I have talked about this a little bit as well. What was your reaction when you first learned about all these things that we're talking about in our practice, actually how effective they are at preventing cancer as well?
Yeah, no, I'll be honest with you. It's not something that, number one, I thought about throughout school and, learning about these things. I thought of them as completely separate topics. Cancer is more of a problem with the genes, and, genes mutated that are replicating, and that heart disease is heart disease. It's a problem with your heart. But really the precursors to these diseases really align. And that was something that was pretty shocking to me, but it's also something to be looked at as like, this is good news. This is something that it's not simple, but in the grand scheme of things, it's simpler than we thought. We don't have to solve all these problems. We can look at them together and take this Healthspan approach in order to, prevent heart disease and cancer. And also the other things we talk about, like dementia, Alzheimer's, and early death.
Yeah, I used to be a little bit offended when I talk to my patients about preventing heart disease, and they say, "Yeah, I'm not that really worried, but not that much worried about heart disease." Like, they weren't being flippant, but I kind of understand it though when I took a step back, because a lot of heart disease is treatable, and people may not be fully aware that about a third, 25% to a third of people, their first presentation of heart disease is sudden death. And so, we don't have treatments for that. At least we don't have effective ways to help with that. But I understand a lot of us know people that have had heart problems, that have had heart attacks or had stents or had bypass surgery, and they're fine and they're great. But on the flip side of that, we also have known people that have had cancer, and cancer seemed like it was really random. You know, people maybe it feels like and can be that it's just a luck of the draw. You know, you just drew the bad cards, you're the one that got the cancer. And you know, the treatment of cancer is more complex than heart disease is. And although they're getting better and better, like there's some pretty amazing therapies now for cancer, still there's a number of cancers that have a really grim prognosis. You know, lung cancer, pancreatic cancer, esophageal cancer, other forms of cancer that you know, those are the things that scare us. Those are the things that can keep us up at night. But what we're going to talk about today is more of a hopeful message, meaning that, you know, cancer we do have some control over that. In fact, we have a lot of control over that. And so one of the things that I think is interesting that we, you know, should probably address up front is, why are cancer rates increasing? You know, we know more and more about what causes cancer. You know, smoking, a big prominent one, and that's dropped dramatically over my lifetime. You know, it used to be over half of adults in the United States smoke. Now it's about 15%. And so that message has gotten through. That's one of the real public health, you know, wins that we've had in our health history. Yet, you know, despite knowing more about the causes of cancer, cancer rates are increasing. I know that can be a disconnect for a lot of people. You know, some of it may be that we, you know, one of the common things that have been attributed to is, well, we're living longer. Well, actually, we're not. You know, we also know that life expectancy in the United States peaked about 8 years ago. It's been flat, if not going down, certainly in the COVID time. So we aren't living longer, and yet cancer rates are going up. And a big reason for this, one of the most important things that I think all of us need to know that are interested in living a long and vital life is that the same thing that is driving higher risks of cancer for us, that's driving increasing rates of heart disease, that's, you know, dementia has tripled, or I'm sorry, has gone up 88% in the last 2 decades and is predicted to triple in the future. All of those diseases have the same underlying fundamental driver that is increasing those rates. And that's what we're going to talk about today is, what is that driver? And then what can we do to minimize our risk of cancer, minimize our risk of heart disease, minimize our risk of dementia, and minimize our risk of stroke. So, you know, cancer is one of those things that you know, I personally know before, you know, going into medical school, you hear a lot about diseases, right? And it's kind of a it's a classic story. Medical students, you're reading about all these diseases and you start thinking you have them. And so people laugh about, you know, well, I was reading about pulmonary hypertension and I thought I had pulmonary hypertension and things. But I remember when we were in the oncology aspect of my medical school training, I was terrified. Like, I thought all of these, you know, all these terrible diseases that are out there, you know, that's the one that scared me the most as well. But the thing that is going on now in our health, the reason that we are struggling as a society and really as a world with increasing numbers of people being chronically ill, increasing numbers of people needing to be on medication, increasing numbers of people with heart disease and cancer, dementia and stroke is that we have this epidemic of what doctors call cardiometabolic disease. You know, as a patient, as a consumer, you're going to say, okay, well, what is cardiometabolic disease? I've never heard that phrase before. But when you know what the factors are that define cardiometabolic disease, you'll realize that, you know, just about everybody has at least one of these. And the factors that define metabolic disease are unhealthy cholesterol levels, high blood pressure, unhealthy weight, and then unhealthy sugar metabolism, whether that is high fasting blood sugars or high hemoglobin A1C, or less commonly known, but certainly something we see commonly in our practice, is people with normal blood sugars, but they're needing a lot of insulin to keep those blood sugars under control. So those are diseases that are common. They're problematic. They lead to medications, they lead to doctor visits, but the real issue with cardiometabolic disease is that that's the primary driver for heart disease, for cancer, for stroke, and dementia. And so, as we'll talk about and as we'll learn, being cancer-free or giving yourself the best chance to be cancer-free at baseline is to lower your risk for cardiometabolic disease. So, Rylan, anything else that you want to add in about metabolic disease and cancer risk at this point?
Yeah, I just think something to note is how striking it is, like how much money we've put in and time and energy we've put into medical technology and creating new drugs and creating new treatments, and yet we're still facing these epidemics, and we're still facing these, like you mentioned, lifespan has slowed. So the paradigm has to change, and that's what we want to present here is, the traditional, what we used to think, solves a problem may not be solving a problem. So I think that I just wanted to point that out, that we as a whole need to take a different approach.
Yeah, so you're exactly right. Like sometimes I refer to this as 20th century medicine. That's the old medicine, right? The wait till a problem occurs and then try to solve that. And really medicine, the history of medicine, that was a really remarkable accomplishment for us. And the classic example is infectious disease. Back before antibiotics, lots of people died from infectious disease, from pneumonia and bacterial sepsis, and even simple things, infections, like in wars, that if people had wounds, what they died from most of the time, like in the Civil War, was infection of the wound, not necessarily the wound itself. And so medicine coming up with antibiotics and the ability to treat these acute infectious diseases was remarkable. I mean, it was really the heyday of medicine. But part of getting really good at treating acute problems, and now it's not just infectious disease, we're really good at treating heart attacks and strokes and acute leukemia and some cancers and people being critically ill, like from COVID, all of those things, where healthcare is outstanding at treating those things. But one of the results of that is that now the biggest problem is chronic diseases like high blood pressure, like high cholesterol, like insulin resistance, prediabetes, like unhealthy weight. And healthcare just hasn't evolved yet. But that's the 21st century medicine. Like, that's what the future of healthcare is going to be, is when the doctors and the health experts are working collaboratively with the patient on helping them achieve their health goals. So thank you for bringing that up. That's an excellent point.
Absolutely. Yes. Well said.
Yeah. So today we are, we're an evidence, we talk about the scientific evidence-based approach to living a long and vital life. So let's talk about two studies around the concepts of what you can do, things of practical points that you can take if you want to lower your risk of cancer as much as possible. And I should say at this point that this does not just apply to people wanting to prevent cancer in the first place. These same factors are also found to be critically important for people who are cancer survivors. So, that's an increasing population for us. We're getting really good at treating the cancers. People are surviving longer. But when you've been through that experience of having cancer, then you know, knowing what you can do to optimize your future to minimize that risk of recurrent cancer is really important. And these same factors apply to that. So the first study we're going to talk about was 135,000 people, and they looked at just 4 factors on how many of them developed cancer versus those who did not. And most of these are common sense, things that we all would agree that they're going to be effective in lowering the rates of cancer. But I think it's the magnitude of that reduction that is really striking. So factor number 1, not smoking, or less than a pack a day for 5 years. So people that had either a minimal amount of smoking in the past or have never smoked. Number 2, less than 1 alcoholic drink per day for women, less than 2 drinks per day for men. Number 3, no more than mildly overweight. So most criteria use a body mass index or BMI of 25 as a cutoff for being overweight. In this study, they went up to 27.5. And then the last one was meeting the minimum recommendations for physical activity, which is greater than 75 minutes a week of vigorous exercise or 150 minutes a week of moderate activity. And they found in this study that those people who met all 4 of these criteria, so let's review again, minimal or no smoking, being physically active, moderate or less alcohol use, and being no more than mildly overweight, those people who met all 4 criteria, the men had 63% less cancer than those in a general US population, and the women had 41% less cancer. So is that surprising to you, Rylan, the magnitude of those?
That is shocking to me. Yeah. I think a lot of times we think of these things as obvious, like, you know, I probably could have guessed, you know, I'm sure everyone watching you or listening to this, you probably could have guessed at least 2 or 3 out of the 5 of those. But how much are we thinking about those things because they are obvious? And how much are we working to implement those things in a way that is going to make an impact? I think is where we have to shift our focus. Because they're obvious, they probably get glossed over a lot from day to day. And that's where we see the impact. But
yeah, I agree.
Striking numbers. I mean, 63% and 40, like that is beyond significant, I know, in medical science.
So. Well, think about all the people that are suffering from cancer. I mean, I think it's 12 million people a year are told that they have cancer, and that we could, you know, we're talking literally millions of people in the United States alone every year. You know, maybe is that number 5 million? Is it 7 million less cancer, you know, cases if we did these things? And you're right. I think this though is information. I mean, I hope that this is something that is, you know, helps people kind of formulate things, because I know we can get kind of narrow in our focus, and we can start rationalizing, like, well, I don't know that drinking, you know, that much is that big of a risk. Or, you know, I think about my grandmother who smoked her whole life, and she would tell me, you know, her rationale was always, well, I know so-and-so had cancer and they never smoked in their life. Or I know this other person who smoked till they were 95 and they never got cancer. I'm like, yes, we can always come up with these isolated, you know, examples, but we're talking about probabilities here. And I think those sometimes are hard for us to understand as human beings. Like those aren't just as intuitive to understand, but I think it's really important, especially if your goal is the long and vital life, which I don't meet many people that are healthy, that are feeling well, that don't have that as a goal. And if that is your goal, paying attention to some pretty simple things can make a big difference in your future.
Absolutely. Yeah, it's a human tendency to rationalize, and then I do it too, like compare, you know, like, you know, my grandparents drank too every day, you know, kind of thing. And it's like, okay, but that doesn't mean that you're automatically going to have the same outcome. Exactly. You might, but you know,
Yeah,
what are the
what
chances of that?
Yeah, well, you're playing the odds here, right? Like it's I don't know, you know, there's different analogies for this, but you know, what makes more sense if you said, okay, well, I want to have a comfortable retirement. So I'm going to, you know, put money away starting at a young age on a regular basis, to, you know, ensure that I have that money at the end. Or I'm just planning on getting the lottery because I know my, you know, my cousin in Florida won the lottery when they were 55 years of age. So I'm thinking that might happen for me. You know, it's probability. I think you're just setting yourself up to have the best chance of success. The next study I'm going to talk about is the one that really opened my eyes from you know, as a cardiologist to the opportunities in preventing cancer. And that's because they used in this study the Life Simple 7. That's the American Heart Association came up with these 7 things that were remarkably powerful in preventing heart disease. And as I said, in one study, over 90% of people, or over a 90% decrease in heart attacks and strokes and heart failure in those people who were able to optimize 6 of these 7 factors. Well, this study looked at the same healthy measures, and we'll talk about those in detail, what those are, but how did it lower the risk for cancer? And what they found was that people were able to meet 6 of these 7 health measures, cut their risk of overall death by 51%. So half the people died, half the number of people died that met these versus those who did not. Cancer death was down 40%, and the risk of heart disease death was down 75%. So you'll see the similarities in this list as compared to the prior study. Number 1 was not smoking. Number 2, healthy weight. So those are the same things as our prior list. Being physically active. But on top of those 3, they added 4 more things. Eating a healthy diet. You know, generally these are whole foods, avoiding the highly processed foods, high sugar added, refined grains, eating fruits and vegetables, whole grains, beans and legumes, seeds, nuts, healthy oils, fish, poultry, having a normal blood pressure, having a normal cholesterol, and having a normal blood sugar. And what you'll notice is that, you know, these 4 criteria that we talked about around cardiometabolic disease earlier, weight, blood pressure, cholesterol, blood sugar, are included in the Life Simple 7. And when people were able to optimize those, they cut their risk of death, overall death, by over half, and their risk of cancer death by 40%, and their risk of heart disease death, the number 1 cause of death, by 75%. And so, you know, it's data like this, studies like this that led us to creating the Healthspan 10. So the Healthspan 10 is the 10 factors that we pay attention to in our practice when we're seeing patients that are interested in living a long and vital life. They want to either prevent disease, they want to get the best treatment if they've already developed the disease, or even reverse the disease in some cases, like blood pressure, like diabetes, like prediabetes, like fatty liver. We have really good opportunities to reverse those diseases. These are the 10 factors that are most powerful to do that. And it's Life Simple 7 factors, but we also add into that important things like getting sleep. And interestingly, I don't know if you saw this, Rylan, now they're talking about Life Simple 7. They're changing it to Life Simple 8 because they added sleep to the list. Did you happen to see that?
I did not, but that's really good news because sleep affects everything. It doesn't sound as great as Life Simple 7. It doesn't roll off the tongue as nicely, but you got to have sleep in there.
Yeah. So I loved it. You know, they were, I don't know, about 5 years behind us, I'd say, in doing that. But, you know, because I realized as a clinician, as somebody seeing patients, how critically important sleep was. The other 2 factors that we added in was stress. More and more as a clinician, as somebody who sees patients, I am deeply impressed with how impactful stress can be on people's health. Like that, certainly we know that acute stress is a big factor in health. I mean, we have a clinical entity called Takotsubo cardiomyopathy, which basically is all the signs and symptoms of a heart attack, but just brought on by stress. And then but the thing that's becoming even more apparent is the impact on chronic stress is having on people's health, on their weight, on their blood pressure, on their cholesterol, on their blood sugar numbers, and then how that chronic stress is leading to the things we're concerned about: cancer, stroke, dementia, heart disease. And then the last one is staying connected to your community, of course, your social connection, but also connection to your purpose, to your contribution. Sometimes connection to nature is what people are looking for. Not only enhances the quality of life, but also leads to that long and vital life. And so, that's our approach in our patients that we're seeing, the people that come to us and say, my goal is to live a long and vital life. I have great things that I want to accomplish still. I have important relationships that I'm not ready to give up. I have a great life. I want to stay functional. I want to stay independent. I want to be there. Then we talk to them about, okay, here's the 10 factors to do that. And if your goal is to prevent cancer, if that's something you're concerned about, whether you have a family history, maybe you've been diagnosed with cancer and you're a cancer survivor, or maybe there's other factors that just lead you to think, okay, maybe genetic testing. I'm concerned about my risk for cancer. What can I do about that? The message is you have a lot of control over that. So, Rylan and I, that's what we love to do. And, preventing cancer is just one of the many benefits that I would say we love to bring to our patients and our clients. So Rylan, your thoughts on cancer prevention overall and the Healthspan 10 and how that has worked with your relationship with our clients and patients.
Yeah, absolutely. Well, one thing I just wanted to mention, I heard this analogy the other day, and I thought it would be worth bringing up because so many of us have seen cancer as a disease of the genes, right? Like you have a mutated gene and it doesn't turn off, or it keeps replicating in essence. Correct me if I'm wrong, but that's how I saw it. That's how I learned it in school. And I thought cancer, like you said earlier, is just kind of left up to chance. Like it's unlucky if it happens, but it happens. And I heard this analogy that made it so much more clear to me. And it was that, think of cancer as a seed in your genes. Everyone has this cancer. Everyone has the potential to get cancer, but it's a seed. So when you put the seed in the right environment, it will grow. If you don't put the seed in its growth environment, or an environment that's conducive to its growth, it won't grow. And so when you go about it in that way, it's not like you're just like, oh, well, this may happen or not. It's you have a goal now and you're actively working to not let that seed grow, right? Not put the cancer in an environment where it will grow. And you can use the Healthspan 10 as your guidelines of, okay, what's an environment where cancer is going to grow, and what's an environment where it's not going to grow, where it's not going to thrive, where I can, deprive that cancer of growth. Because really what cancer is like chronic long-term exposure to carcinogens or cancer-causing compounds, or, stress, or, whatever you want to call it. But that's something that's how I think about it, essentially. That helps it make more sense to me. And that's how I describe it to your patients, my clients. That's how we discuss it and go about it, versus the whole risk thing, or genetic risk thing. Because there's things in life that really are unexplainable sometimes. It's like, this person did everything right. Why did they get cancer? And like, maybe we can't explain it, but when we don't want to act according to those odd cases. We want to act according to what the majority is and what the studies show us that we can do every day. And so act towards not letting that seed, that cancer seed that's within everybody, it's in every cell, not letting that grow.
Yeah, exactly. And, there's a genetic component to this, and there's a lot of complexity. There's an environmental component to cancer for people. I mean, we know pollution, radiation, like all of these factors can increase that likelihood. But what we're talking about is lowering that risk regardless. Like, of course you want to avoid excess radiation. Of course you want to avoid excess pollution. Of course you want to do your cancer screening that makes sense. Like, for women, mammography, for men, prostate cancer, colon cancer screening. Like, these are evidence-based approaches. It doesn't mean that you don't do all of those things, but while you're doing those, that realize that these other factors, these 10 factors, have a huge impact on that risk. And sometimes we have, and I understand this, like it's a human nature thing to say, okay, well, but what's my guarantee? Like, if I do all this stuff and I get cancer, I'm going to be really upset. and I understand, like, but because there are no guarantees in this. What you're doing is improving your odds. But I will say, if there is a guarantee, what I would say this is that if you do all the things on the Healthspan 10, you do you're active, you eat well, you have great blood pressure and cholesterol and blood sugar, and you're connected, and you're avoiding toxins and sleeping and managing stress. Is that a guarantee you won't have heart disease? Is that a guarantee you won't have cancer or dementia or stroke? It is not. It's not a guarantee, but it's going to dramatically lower that risk. But I'll tell you what I think is guaranteed. Your quality of life is going to be a lot better, so whatever time you have left until that, that terrible diagnosis, if that's in your future, what I know for sure is that you are going to have a much higher quality of life living, adherent to those the Healthspan 10, than if you do not.
Yeah, absolutely. Number one metric I ask my patients for, your patients, my clients, for when we talk is, do you feel good? Like, are you happy? That's the one thing it's hard to quantify data wise. Of course, we're looking at labs, we're looking at progress in a quantitative way, but that's the number one quality that we want is, if you're doing all these things, are you feeling good? And that's oftentimes like one of the first things that comes when people start prioritizing their health and prioritizing things that they weren't before, like sleep and stress, for example. They just start feeling better. And from that moment on, it snowballs, then you feel good enough to take on new challenges and do new things that, just continue to add to the quality of your life. So that is so important.
Yeah, amen. Beautifully stated. All right, so that will wrap up things today. I will leave you with, if you're interested in a comprehensive and connected approach to your healthcare, then check out our website, HealthspanMD.com. Schedule an appointment with us. We are going to be opening our brick and mortar practice in the coming months, which I'm and Rylan are really excited about. And then also join us in 2 weeks. We are going to be talking about another, commonly feared disease, and that is stroke. Stroke risk is predicted to increase 70%. We're going to talk about how to lower that risk by half or more. And you may notice that there may be some similar factors in that were discussed today. This information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. Thanks for watching, and if you want to learn more about living a long, healthy life you love, click the link below to learn more about how we help people increase their health span. And if you like this video, hit the like button below, share it with your friends, and be sure to hit the bell and subscribe.